Today, we're diving into some of the most common and, frankly, most stubborn injuries out there. You know, the kind that just refuse to heal, no matter how much you rest them.
We've all been there, right? That nagging ache, maybe it's in your elbow, your shoulder, or your heel. It starts off small, but pretty soon it's this constant, frustrating companion that just drives you crazy. Well, it turns out the reason it won't go away might be because we've been thinking about the problem all wrong.
So what's actually going on? Well, the medical world calls this tendinopathy. Now, for years, we all called it tendonitis, with that itis on the end, assuming it was all about inflammation. But the latest science shows it's usually something completely different. It's what's called a failed healing response, where the tendon tissue itself actually starts to break down. And this, right here, is the most important idea to grasp. Your tendon problem isn't like a fire that you need to put out. It's much more like a rope that's slowly becoming frayed, weak, and disorganized from overuse. And that little distinction, it's absolutely crucial, because it changes everything about how we should be treating it. Okay, so this brings us to what's been the go-to treatment for decades, the corticosteroid injection. If you've had a persistent joint or tendon pain, chances are this has been offered to you.
And the logic made a lot of sense back when we thought the problem was a fire, right? If you see a fire, you grab a fire extinguisher. And corticosteroids are incredibly powerful. They go in and just knock down that inflammation and pain, giving you really fast relief.
And check this out. This is how they do it now. It's not just a blind poke. Using ultrasound, doctors can guide that needle with absolute pinpoint accuracy. But notice something interesting. They're not aiming for the tendon itself, that frayed rope. They're targeting the sheath around it, which is often where the real inflammation is. It's a much smarter, safer way to do it.
So what's the final verdict on these shots? Well, they're fantastic for short-term relief, no doubt about it. You can get up to 8 weeks of feeling a lot better. But the evidence for any real long-term benefit is pretty weak. In fact, for things like tennis elbow, some studies suggest you might actually be worse off down the road. And here's the kicker. Repeated injections might weaken that already frayed rope even more.
This is where the whole game starts to change. We're seeing a huge shift away from just managing symptoms towards actually trying to regenerate the damaged tissue. And that brings us to our next player, platelet-rich plasma, or as you've probably heard it called, PRP.
Let's go back to our analogies. If corticosteroids are the fire department, just putting out the flames, think of PRP as a specialized construction crew. The goal here isn't to just quiet things down. It's to bring in the workers and materials needed to actually rebuild and repair that frayed rope.
So how exactly does that work? Well, the PRP is made from a small sample of your own blood, which is spun down to concentrate all these amazing little things called platelets. And as you can see here, that concentrated plasma is injected directly into the damaged part of the tendon. The whole idea is to deliver a massive dose of growth factors right to the construction site to tell your body, hey, we need to repair this now.
Now, the single biggest advantage of PRP is that it's incredibly safe. I mean, it's made from your own blood, so major side effects are basically unheard of. But here's the catch. The evidence is, well, it's still a little all over the place. Results can be inconsistent, and a big reason for that is that not all PRP is created equal. There are a ton of different ways to prepare it, and studies don't always use the same recipe, which makes comparing results really tough.
So let's put these two head-to-head. It really boils down to this. Corticosteroids are all about fast pain relief. They're quick, and the evidence for short-term help is solid. PRP is playing the long game. The goal is actual tissue repair, but it takes a lot longer to see the results. So you see, they're really two totally different tools for two completely different jobs.
But wait, there's more. Let's talk about a third category of treatments. These don't rely on injecting some kind of magic liquid. Instead, they use physical force to basically hit the reset button on the healing process.
The first one is called percutaneous needle tenotomy, or PNT. Now, I know this is going to sound a little weird, but the idea here is to carefully re-injure the damaged tissue. You're essentially tricking the body into launching a brand new and hopefully much better healing response. A great way to think about it is like aerating your lawn to get new, healthy grass to grow.
The process itself is surprisingly straightforward. First, the doctor uses ultrasound to find the exact spot where the tendon is frayed. Then they take a needle and pass it through that bad tissue over and over again, maybe 10, 20, even 30 times. All that tiny microtrauma causes a little bit of bleeding, which guess what? Releases all those platelets and growth factors, the body's own natural construction crew, right where you need them.
Now, there's a cousin to this technique called PICT, which stands for percutaneous irrigation. This is for a super specific problem, calcific tendinopathy. It's when these painful little calcium deposits, think of them like tiny rocks or bits of sand, form inside the tendon. PICT is designed to literally flush them out. And again, look at how incredibly precise this is. Guided by ultrasound, a needle goes right into that bright white spot. That's the calcium. Then they use saline to gently break it up and wash out all the fragments. Just getting that physical irritant out of there can provide a ton of relief.
Okay, so we have fire extinguishers, we have construction crews, and we have these mechanical resets. That is a lot of options. So the million-dollar question is, what actually works? Let's take a quick look at what the evidence says for some of the most common issues.
So here's a quick cheat sheet. For tennis elbow, yeah, steroids give you quick relief, but PRP really seems to win out in the long run. For that awful heel pain from plantar fasciitis, both PRP and PRNT show much better long-term results than a steroid shot. Now, for the rotator cuff in the shoulder, it's a bit more of a toss-up. Steroids definitely help in the short term, but the best long-term option is still being debated.
So after looking at all of this, what's the single most important takeaway? It's this: there is no magic bullet. There's no one-size-fits-all treatment that's going to work for everyone every single time.
The right choice really comes down to you. It depends on which tendon is hurt, how long you've had the problem, what your personal goals are, and, of course, what the latest science says. It's all about moving toward a much more personalized approach to medicine.
You know, if there's one common thread that ties all of these advanced treatments together, it's precision. It's using technology like ultrasound to see the problem clearly and deliver the right solution to the exact right spot. This really is the future. Way less guesswork and way more targeted, personalized care.
So, if you're out there dealing with one of these injuries that just won't quit, the real question to ask yourself is, what's my goal? Are you just looking to put out the fire for a little while, or do you need to call in the construction crew to rebuild that frayed rope for good? Knowing the difference is what empowers you to have a really smart, informed conversation with your doctor about what treatment is truly best for you.